Yale's program in addiction medicine is unique because we bring together folks from tons of different disciplines who are passionate about increasing access to quality care for patients with substance use disorder.
The relationship between faculty and fellows is super inviting. We call it a family in the program in addiction medicine, and we really want to give fellows opportunities to do research with us, to pursue their own interests.
We have a huge breadth of experiences from the hospital setting to the community setting to street medicine.
One half is spent really in that outpatient setting, developing deep, long relationships with our patients, caring for them at every step of the journey.
There's the APT Foundation, which is this wonderful low-barrier methadone clinic where folks can sort of come in same day and get started on MOUD treatment. So one of your rotations will be there within the central medical unit. So that's essentially a primary care clinic that's integrated within methadone clinic, so it's really quite a unique opportunity.
Our fellows also rotate at the Addiction Recovery Clinic. It's an addiction treatment clinic embedded in primary care at the Cornell Scott Hill Health Center. There they play a role not only in caring for patients, but also teaching.
We train our fellows at the Yale New Haven Hospital, and they work on 2 different campuses there, so the St. Raphael's campus and the York Street campus.
And then also the consult service in the hospital where we take care of people who are coming into the hospital, not necessarily for a reason related to substance use, but they might have a substance use disorder that's kind of complicating their care, and we can help them.
And last but not least, we'll do a rotation in the opioid reassessment clinic at the VA, which is this great multidisciplinary pain management clinic, and they really help you feel comfortable managing these complex patients.
By the time I left the program, I really felt like I had a solid understanding of how to take care of these patients in all these different sites.
I came to Yale thinking I was going to do my residency and leave in a couple years, and I've been here for over 20. So it's because of the people that are here and the mentorship that I have received and continue to receive.
Each of our fellows has a mentor that they're paired with, as well as an advisor. And they meet with their mentors and their advisors, talk about their career goals, talk about their research interests. If they have an interest to go on to develop research skills or to develop other specific skills, we work with them to think about what's the best fit for next steps for them.
There's kind of research based on substance use disorder, so research looking into treatments for opioid use disorder, like these new injectable formulations of buprenorphine. And then there's also research looking at different settings, so implementation science for how do we integrate addiction care into HIV clinics, for example. And we have close connections with the School of Public Health, so other studies looking at epidemiology and kind of trends in overdoses, for example, in Connecticut.
Really understanding and utilizing the resources at Yale. Last year, some of the fellows, for example, published papers with us on xylazine, which is a novel contaminant that's a veterinary tranquilizer that's found in fentanyl. So really we're also helping people publish and conduct their own research and their own commentaries. So the sky's the limit.
But there really is this bi-directional relationship where at some point during the year the fellows start to teach us things, and that's when it feels like we're really making a difference, not just for kind of our patient care, but also in terms of training up our fellows to be true addiction medicine experts.
All of our curricula is tailored to shine lights on some of the systemic inequities that have been part of addiction medicine and addiction psychiatry for a long time, shine lights on those inequities and really help arm our fellows with tools to break down barriers.
You actually see that sort of through the thread of the longitudinal didactic curriculum, as well as everyone is sort of very intentionally trying to integrate and make this a welcoming and supporting environment for all.
I'm one of the mentors in the REACH program that Dr. Jordan and Dr. Tetrault run that encourages people from minoritized populations who are interested in addiction.
Representation is important, and we need our patients to feel like they are able to have providers who they can relate to.
I think you see that too, just in their commitment to the sites that we rotate at. You know, we're working in federally qualified health centers, we're working in low barrier methadone clinics, we're really working with an underserved population, and we really do the best that we can to advocate and help bring change and provide care in these spaces.
This is a specialty where you can actually walk with patients, you can value their expertise, and you can watch people get better.
You're going to work hard, you're going to enjoy the journey, and at the end of the day, you would have a huge swath of resources that's going to be helpful for you making that next decision of what's next as I practice addiction medicine.